Roots get stuck in the mud. Let's pack up a life, baby, and call it a night. 'Cause the longer we stay here, the harder the fight. I said, hey, yeah, 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 call it a start by leaving behind what's breaking our hearts. I said, hey, yeah, 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 follow the spark. Ain't nothing but a one way. We won't regret this. Let's kiss the past goodbye. I'm longing to live this free life I've been hearing about. You will see us howling like wolves in the night. 'Cause nothing is stronger than wanting what you might get. I said, hey, yeah, 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 call it a start by leaving behind what's breaking our hearts. I said, hey, yeah, 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 follow the spark. Ain't nothing but...
Good evening and welcome to another MG Wellness Ask a Doctor. I'm Nate Manahan and I am always together with the people over my shoulder here, Dr. John and Dr. Kelly. There they are. How are you, Dr. John and Dr. Kelly?
Doing great.
Doing great. Hope everybody else is doing great in our wonderful little isolation.
All right. All right. Well, here is what we are going to tell you a little bit here. Let me bring my audio up a little more. So one of the things we're going to be doing is giving an update on the coronavirus. So Dr. John, Dr. Kelly, can you give us, where are we now? Where is COVID-19 and how have things changed in the last week?
So I think we are beginning to see in certain spots the beginning of the flattening of the curve that we've been talking about for weeks on end now. And the flattening of the curve is first going to happen in the number of new cases that are diagnosed each day. And we're not seeing that everywhere yet, but in some of the hot spots in particular, we're beginning to see that. One thing that's really important, we were just discussing tonight, one thing that's important to understand is that the new cases diagnosed each day is kind of the first thing we're going to see change. Then we're going to see hospitalizations follow after that. And then after that comes the curves about those who have died. And so it's an extended process that will go on over weeks and months. We know that. But that flattening of the curve, we are starting to see. What else, Doctor?
We're also starting to see that although people were really, really worried about overwhelming the hospitals, that because of following the guidelines that were put out, first the 15 and now the 30, that has actually prevented our hospitals from being overwhelmed, which is good. And there is no place where they're actually out of ventilators, out of hospital rooms, people waiting to get into hospitals.
So that's good. And PPE is getting to the places that were running out, New York City in particular, New Jersey, and some other hotspot locations. But the states on the West Coast that have kind of started to make a real difference in the flattening of the curve, they are actually sending ventilators and other supplies to places that need it more than they do, which is a very encouraging sign. Yeah. What about treatment updates?
Treatment updates are very similar to what we talked about last week. There has been very positive data that's come out with chloroquine, hydroxychloroquine, and azithromycin, hydroxychloroquine and zinc, remdesivir. people have briefly talked about actually aerosolization, like nebulizing, like for asthmatics. Hydrogen peroxide has been tried. Plasmapheresis. Do you wanna talk about that?
Yeah, it's, so you may have seen some articles about blood donations, people asking for blood donations from those who have recovered from, COVID-19. And when you've recovered from it, you should have antibodies in your bloodstream. And so they want to get that blood and then take out of the blood what is called the plasma. And in the plasma will be those antibodies that can be given to other people who are struggling very, very much with coronavirus illness. And there have been some encouraging initial results. We don't have big studies, but initial results.
That's honestly a much, much riskier procedure than using antibiotics that have been around forever, like hydroxychloroquine and
Antimalarials.
well, they're still antibiotics.
Yeah.
So chemos. It's just a term, but antimalarials and the antiretrovirals like remdesivir.
Right. So all of those things are looking to be positive. We haven't seen anything truly negative from any of these innovative treatments or old treatments that have been around for a long time. So that's very encouraging.
So, next question I would have is, I'm hitting mute, Mike. Next thing I would have is, tell me about, because I haven't asked you guys this, and I've been wondering. Yesterday, the news story hit that a animal in Brooklyn Zoo had tested positive. Does that have any impact on anything, or is it just kind of an anomaly and something we'd expect when there's this many people in New York having it? Eventually, it's going to go to some of the animals.
Well,
Yes.
most viruses came from animals originally, and they've mutated enough that they're able to infect humans. But it's not that they've lost their ability necessarily to infect animals. So to have an animal get it is not surprising, but understand that it doesn't mean that the animals are going to get as sick as humans. Otherwise, it wouldn't be a very good, what we call reservoir for holding the virus around.
Right. I think what a lot of people get concerned about is then, I know that this is a zoo animal, but then do home pets become carriers for coronavirus? We don't have any evidence of that, that they
Carry it for long.
yeah, or that they can infect humans that way or whatever. So
there have been cases of animals getting
yes,
the virus.
cats, yep.
And a dog in Hong Kong. But that's few and far between. It's not common.
I think we probably have more to learn about that, and so we're going to hear various reports like that.
And there's much we don't understand about viruses in general.
Right.
And this is really hard to explain. There are pieces of our DNA that are identical to other viruses. The Sark gene, that's just one example. There's a ton of them in the human genome. And so, for years, there have been viruses infecting humans. And sometimes humans will actually adapt that viral DNA.
Yeah, we just have so much more to learn, and we're not going to learn everything about viruses from this virus. And there are unique things about the coronavirus that we're learning every day. So I think that's one area where we can say, well, we don't have a whole lot of evidence in this direction, but we just don't know.
So let's take a second. I brought the slide up prematurely a second ago. Just a reminder, we always ask that as you're joining us live on these Wednesday nights, a couple housekeeping tips that we want to do. We would ask that you would share this. Just click on that share button right now. Share to your friends and family on Facebook. If you're on YouTube, click the follow button. If you're on Facebook, click the follow page or like the page, and then we would certainly encourage you to share it with your friends and family, especially as we're live, because we're going to be taking your questions. So if you ask questions in the chat, we see lots of hellos from May and Nancy and Janice and Kathy and Michelle. Thank you for saying hello, and we're going to be doing more and more questions as you have them. We have a few preset questions always, but we want you to be doing that. And then, of course, enjoy your time. And I would also say this, we are here in Indianapolis in a severe thunderstorm warning. So warning to us, if something happens and we go away, I'm sure we're fine, or we decide we need to go down to the basement where we're not right now. But just a heads up. So, you know, it's good to be a heads up. Tonight, Dr. John, Dr. Kelly, we're going to talk about exercise. And specifically, let's start with, does exercise have an impact on our capability of actually fighting off the disease before infection, and does it help us battle the infection once it's there?
Great question.
Yes.
And besides, real quickly, besides not being in the basement, we're in a room full of glass windows. So
It is literally a glass house, so we should probably not stand here.
I'm not allowed to throw stones.
Nice. Anyway, yes, exercise can be very helpful. There are some very important things to understand about it, though. Exercise is very important in fighting all kinds of diseases, including infection. Now, have there been any studies showing that exercise specifically helps with coronavirus?
No, and there won't be.
Yeah, we don't have any evidence of that. But in fighting off infection, colds, flu, seasonal kinds of things,
Especially respiratory viruses.
yes, then exercise is very important. The one caveat that I would give that I think is important to understand is that once you are sick, do not expend your energy on beginning an exercise regimen. If you have not already started, don't start it once you're sick.
With an infection.
With an infection, yes.
When you're acutely ill, it does not do any good because of the other part of Dr. Kelly is going to talk about more, about the level of exercise and its importance with regards to viral infections. And understand, if you're starting exercise for the first time, it's more intense than if you're persistently doing exercise.
Starting from nothing takes more of your energy than when you're doing exercise every day.
And we'll see how many people recognize this quote. Remember, 90% of the fuel is used on takeoff. Just for the people out there, you know who you are.
Help me, people, help me.
And that was lightning.
Okay, so the one thing that I wanted to say is that 2 to 3 weeks, I know you can never time when you're going to get sick, but the best evidence shows that exercise starting 2 to 3 weeks in front of an illness is the most helpful for an illness. Now, I'm not saying only 2 to 3 weeks. It can be longer than that.
No, and so the big point about that is exercise.
Yes.
And then you'll be ready 2 to 3 weeks before.
Yes. The other side of the coin is this. We always think, when I hear the word exercise, I like roll my eyes, right? And I think about somebody training for a marathon, and I hate running.
Or
and
from Saturday Night Live, we're here to pump you up.
like I said, people, you need to help me. So anyway, what was I saying?
Exercise.
Level of exercise. I always think,
not marathon.
I always think, oh my goodness, I absolutely hate it. I'm going to absolutely hate this. Exercise just sounds terrible, awful, painful. I, have this weird pain in my side and I breathe funny and I hate it, hate it, hate it. That's what I think of when I hear the word exercise. Now, when you say, let's go for a walk, that sounds great to me. Being outside, enjoying the sunshine, awesome, awesome, awesome. So, what is really important on the other side of the coin is those of you who are massive exercisers, i.e. marathon runners, one of the things that is so interesting to find is that after training for and running a marathon, those marathon runners are at about a 10% increased risk of getting sick because they have expended so much energy on their exercise that their body has no ability to fight infection. Very interesting. So I'm not saying don't run a marathon. That's not what I mean.
Interesting, Doctor.
But what I do mean is, in terms of fighting infection,
So
it's
what
important to be
what you're saying is
balanced.
don't run a marathon and get sick 2 weeks later.
Yeah, anyway, so be balanced, moderation. What we've been doing is walking at least once, if not twice, every day.
30 minutes straight aerobic exercise
Yes.
is what's been shown to be beneficial for many, many things. It's not just this. We know that it helps in overall fitness. It helps with fighting cancer. It helps with heart disease. It helps with respiratory problems.
So all of that to say, 30 minutes of continuous, if you want to call it walking or exercise or whatever you want to call it, at least 3 times a week, no more than 5 times a week,
Because your
is
body
helpful
does
to
need
fight infection.
Your body does need to recover some.
Yeah, it's kind of like we do with intermittent fasting. Your body needs time to recover from eating. Your body also needs time to recover from exercise.
I guess that's why I had problems for a while. I never tried to stop eating.
And there you go.
All right, so let's talk about, I'll switch to my camera for a second so you can see them over the shoulder and they can have a moment off the camera. There's the blurry section over there. But the things that we do exercise, is it important? Let's say we're sick and we're compromised, and you were kind of starting to talk about this a little bit, and specifically with any illness. What are things that we can do to strengthen and exercise? Because we're not going to go run a marathon at that point. What are the things we should do? What are some other sample things that we can do when we just don't feel like getting out of bed that may be helpful?
So one of the things that can be very, very helpful if you're weak and you're in bed is to either do yourself or have someone in your house help you if you're very weak do exercises. And so if that means literally taking your arm and doing this, or flexing your leg and extending your leg, just to not let the muscles do something we call atrophy, which is kind of shrink.
Your body wastes itself really quickly.
Yeah.
Your body uses muscle relatively quickly to heal itself. And if you're not exercising, you will deteriorate and lose muscle mass very quickly if you're in bed. Even when we started in medicine, 1 or 2.5 centuries ago, they did not understand how important it was for physical therapy and occupational therapy of individuals in the ICU. And people would be in the ICU, they'd be in bed for a week or two, and then they couldn't do anything for months.
Right.
And now they understand the importance of basically continuous muscle motion, at least.
Yeah. One of the other things is that, I was going to say a couple things. Number one, we had a family member about 8 weeks ago, that was really, really sick, and wasn't somebody who was weak, but became very, very weak from being sick. And so we did those kinds of, flex your leg, extend your leg,
Get up and
flex
walk.
your arm, and helping walking, just taking steps back and forth, just to maintain muscle.
I mean, something as simple as you're sick with a cold and you're in bed for 3 days, it takes 6 to 9 days to recover from being in bed for 3 days. So you never want to be just bed bound if you can help it.
Another thing I was reading about this yesterday, another thing that's important when you're trying to fight off a respiratory illness for sure is doing really deep breathing exercises, because we have muscles that actually help
I mean,
our...
like when I call you on the phone,
What?
the deep breathing.
Oh, my word. He's such a weirdo. Please help me. So if you do really, really deep breaths multiple times in a row, now I'm not talking about getting yourself dizzy and passing out and all that kind of jazz, but taking deep breaths and letting it all the way out is really, really important in maintaining the muscle of the rib cage.
Absolutely.
So,
So
did I answer the question?
is that why people say turn your head and cough? I'm kidding.
Stop.
All right.
So off the wall, please.
Just so you know, this is our current radar situation. So we'll be watching that if you want to see. I have a live radar for all of you. Back to the cameras. We're going to cut this short. I'm just telling you ahead of time.
Yes.
So get your questions in quickly.
Oh, here comes
Though
the
I
owl.
just want Dr. Kelly and Dr. John. I'm not bringing them all up, but everybody says you're funny. Laugh out loud for sure. Exercise. Thank you guys. Lots of good questions. One of the questions I would have is when it comes to endurance and strength exercises, are there any different, like let's say weightlifting, doing things to get stronger, bulk up, the things that make us men? Oh, sorry, no. Getting ready for football season. Is there benefits and different benefits for our immune system for those exercises?
So weightlifting is not bad. It depends on what type of muscle you're trying to build. The idea is if you're really trying to, bulk up and look like a bodybuilder, that's very different than trying to build muscles just for strength, or trying to build muscles for running, which are the longer muscles as opposed to shorter, bulkier. What were you going to say?
The most important muscle to build in terms of strength to fight infection is your cardiac muscle.
And your lungs.
Yes, and through that, your lungs.
Yeah, your chest wall.
Yes,
muscle.
and so
Aerobic exercise is very important.
right. When you're talking about ability to fight infection, that's really the most important type of exercise.
And there's no randomized trial on this that I could find, but I've always been told this, and I know I hate when people say that, but I think it's actually, there's some evidence to it. Swimming is very good because of it's using multiple different muscles. It makes you train your breathing and its resistance along with being aerobic. So it hits all of the good things.
It hits all those good things.
As long as it's warm water.
And the other thing that's really, really good about swimming is that it's so easy on your joints.
Yes.
So
Yes.
if you have joint
Absolutely.
issues, swimming is not only the best cardio-wise, but it is also the easiest on your joints.
And we've talked about that at the very beginning of all this, about like water aerobics is really good for someone that can't do normal aerobics.
Yes.
Because of the pain in the joints or age or whatever. Water aerobics is actually very good.
Yeah, I've had a lot of patients that I've encouraged to, and they have done water aerobics classes, and it has been a tremendous help, and they've also found it to be fun. Kind of intimidating at the start, but then they've loved it.
Just watch out for that.
What? Bolt of lightning that just came through the window?
Or the warm water that passes by.
Nice.
Sorry.
You just cannot take him out. I'm just telling you. Well, we actually aren't taking him out in public now, so that's good.
But that's probably the problem.
Right.
Because I'm cooped up.
Holy moly. Okay.
And this is the only time I get to talk to anybody else that's not used to my stupid comments.
Anybody want to call him and just, you can phone a friend?
Lifeline.
Hey, that show is coming back with Jimmy Kimmel as the host. So I think
Excellent.
I think it's coming up in a couple weeks. So one, we're not getting a lot of questions, so everybody thinks you're funny, John. So I don't know what we should say, if we should tell you that. But you're going to see it when you
He
look
can
at the
start his
comment
own
section
live
later.
show.
So
No.
But what are some of the things that we can do right now that would be the most, if we're the most lethargic people in the world, we don't walk, we don't do anything. What's the first step if we get deep, if we just can't get across the room without heavy breathing?
Well, if you can't get across the room without heavy breathing, you probably need an EKG to make sure your heart's okay. And I'm serious. Before starting, if you're having problems, just walking to the mailbox and back, or if you're getting short of breath,
Right.
walking up a flight of stairs, you need to get your heart checked out. That has actually been proven. If you're short of breath, walking upstairs, you need to get your heart checked out. It does not miss many people with heart disease, but it overcalls.
Well,
and when we're dealing with heart
you'd rather
disease,
overcall it.
that's what we want.
Right.
So if you can go upstairs without getting short of breath, but you can't walk 30 minutes, start the first few days walking 15 minutes or 20 minutes and extend it over a week or two.
One of the things I think is really important in this particular time where we are isolated and we've got to do social distancing and all of that jazz. If you have a nice day of weather, and we did have a beautiful day prior to this storm, go outside. Two things happen. Number one,
You wave to people because you can't. get
you're
close to them
socially
anymore.
distanced. If you're walking in your neighborhood, you're socially distanced. So you're cool. Number two, you are getting vitamin D.
Yes.
Vitamin
absolutely.
D helps you fight infection. And number three, you're getting your exercise.
Yes.
So you're behaving all the guidelines. It is also very, very, very good for your mind.
Well, and the other part of it is, all those things are absolutely correct, but we also know that a lot of America, and we'll not talk about tonight why, but a lot of America actually has seasonal affective disorder.
Yes, we've posted about it before.
And getting outside helps that.
Yes, and especially, I think seasonal affective disorder this year has an opportunity to reinfect all of us because we are stuck. We feel like we're stuck. And we have stresses that we never imagined we would have here in 2020.
Yeah, she was so worried about me trying to escape the house that she nailed my foot to the floor.
Oh, right. Nope.
So I'm running in circles. If you look at the edge of my shoe, it's worn out.
His brain's running in circles, I'll tell you that. I'm going to be running in circles real quick.
Yeah, because I'm running in circles. You're following me.
All right, quick question.
Nate?
So Ted asks, muscle activation therapy, are you familiar with it? And localized isometrics to help flexibility. Is that helpful?
I do not know about muscle activation, but if you do, go ahead and talk about it. Localized isometrics, absolutely.
Okay.
But
Go
I
ahead and
don't-
talk about that.
No, you're absolutely right, Ted. That isometrics are very, very important.
Especially if you do
Explain
it
what it
Tom
is.
Brady's way. Make sure you follow Tom Brady's
Well, if you're
protocol.
following it,
TB12.
always follow TB12.
Whatever.
TB12, who's now on TV.
TB. Absolutely.
Go ahead.
And
But
apparently, I have not watched it, but I may actually, I'm trying to find a bootleg, did a 2-hour interview with Howard Stern today. But, all right. Back to it. All right.
I don't know
I don't know
about
if I could
muscle
stomach
activation
that.
therapy, but I will find out, and I will we'll
So
post
explain
on it.
for the rest of the audience what isometrics is.
There's a lot more to it than this, but basically resistance training when you're training both.
Sides of a muscle group.
Yes. Instead of just training one side of a muscle group, you're training both sides. For instance, biceps and triceps.
Biceps, I have none. Triceps, I have even less.
For instance, what's the classic thing you see people doing when they're weightlifting is bench press. But, you always see people like push it up really hard and then drop it down. That actually isn't what's helpful. it's better to be using less weight and going up slowly and down slowly so that you build all of the muscles around it.